You've been ordered to do a cardiac stress test because you and your doctor want to know how likely you are to have heart problems. But how well does the treadmill stress test predict that? That's exactly what we're going to cover in this video. But first, let's discuss how it's done. The cardiac stress test is done via something called the Bruce protocol. That is a protocol that is standardized across speeds and inclines, and it starts with a speed of 1.7 miles per hour and an incline of 0 miles per hour. After 3 minutes at that stage, you move on to the next stage for 3 minutes, which is 2.5 miles per hour and a 5-degree incline. After 3 minutes there, you move on to 3.4 miles per hour and a 10-degree incline, then 4.2 miles per hour and a 12-degree incline. Finally, you go to 5 miles per hour and a 14-degree incline. So that is the Bruce protocol for the ECG or the EKG stress test. Now, how strong of a test is it? Well, according to one study, they found a false negative rate of 32%. What that means is that 32% of people with heart disease will not be flagged or detected by the cardiac stress test. That's for various different reasons, but that shows you that there is a very high rate of errors. To not detect somebody with heart disease who's on the verge of a heart attack or a stroke is definitely not a good thing. We also need to distinguish between the stress test for health versus the stress test for fitness. As a health test, what they're looking for is any abnormalities in flow and electrical activity. But for some careers, they use it as a fitness test. They already know you're healthy, but they want to know to what stage can you perform. Maybe you can do it to stage 2, 3, 4, etc. They want to know, are you fit enough to do your job? This is especially true in pilots as well as probation officers and a few other careers, potentially like firefighters and so on. And so if you need help putting together a personalized exercise program to help you pass the stress test, you can feel free to click on the link in the description below. That'll take you to our website where you can schedule a free 10 to 15 minute Zoom chat where we'll chat with you about A, your situation, and B, whether or not we can help you. There's no pressure, no obligation, no sales pitch. It's just a quick discussion to again assess your situation and see whether or not you can be helped. Now let's discuss about what does the stress test measure. I kind of mentioned it earlier, but one more time, the stress test measures two things. One, blood flow, and two, the electrical activity of the heart. Here's what it doesn't measure: plaque. And it's usually ruptured plaque that causes blockages in arteries. If it's to the heart, that's a heart attack. If it's to the brain, that's a stroke. And the interesting thing about plaque does not affect blood flow until it blocks more than 50% of the artery. The interesting thing is that one study found that 68% of people who experience a heart attack do so when their arteries are blocked less than 50%. And that's because there's two types of plaque. There's hard plaque and soft plaque. Soft plaque is way more likely to break off and block an artery. There are a few superior ways of measuring your likelihood of having heart disease compared to a stress test. I'll list two of them here. One measurement is called C-peptide. What is it? Typically, it's a measurement to assess your insulin resistance or blood sugar levels, or something that really affects your blood sugar levels. It's a better measurement of fasting insulin than fasting insulin. So it's usually used in blood sugar disorders like insulin resistance or outright diabetes, but it's a very helpful marker for heart disease because it's got a very strong relationship to it. In one study, researchers recruited non-diabetics with an average age of 55, and they followed them for 15 years. In that time, 12.2% of people with a C-peptide level above 0.984 nanomoles per liter died due to heart disease. In comparison, only 3.8% of people with a C-peptide level below 0.418 nanomoles per liter died from heart disease. So you can see that C-peptide discriminates hugely between those likely to experience heart disease and those not. Another fantastic test, possibly the best one I'm aware of, is called HRR, or heart rate recovery. What that is that you go to a laboratory and a technician takes your pulse to its predicted max. If you're 60 years old, they might take your pulse to 160. Once you reach your max, immediately the exercise stops and you just sit there and rest for 1 minute. Heart rate recovery is by how much does your pulse drop after 1 minute of recovery. And that has a very strong predictive ability on your likelihood of heart disease. In one study of 2,428 people with an average age of 57, 19% of people whose average heart rate recovery was less than 12 beats per minute after 1 minute of recovery, they died within 6 years. but only 5% of people with a heart rate recovery better than 12 beats per minute died within 6 years. This discrepancy is even more pronounced in people over 65. In those who are over 65 with a heart rate recovery below 12, 28% of them died over the next 6 years. But a lot less died if their heart rate recovery was better than 12 beats per minute. If you like this information, we have a special newsletter for people over 50. You can click on the link in the description below, and that'll give you the opportunity to subscribe to that newsletter. You can always unsubscribe. Thank you, and goodbye.